The Baker Foundation is one of those foundations in our region that really always comes to the plate when there ever is a need, be it healthcare or otherwise. They're a very prominent family, but also very low-key. They did a lot of their work behind the scenes. When approached, they've come forward and really helped out all of us.
When you look at basic research in oncology, you've got to have the facility available, and you've got to have the technology available, and you have to have the expertise available to move research forward. And the Baker Lab uses all of those dimensions to really put those dollars to work. And the collaboration that we have with the University of Windsor through the Windsor Cancer Research Group, the university itself, allows clinicians to partner with the university researchers. We collaborate to develop the questions to ask in terms of how to develop the right research questions. And then the research gets done with kind of an endpoint in mind about what to study and why to study those areas of research.
My dad was a cancer patient, and he always told me that all he wanted was hope. Was there a possibility of you ever getting any better? And one of the things about the MRI machine local was that we could give our cancer patients a little more hope. Cut down their wait times from 6 months down to just 2 weeks, which made just things in life a lot easier for our cancer patients. Once or twice a year, the Cancer Center comes to us with a list, basically a grocery list of things that they need that just aren't funded. We're very fortunate that we have some equipment here that other parts of the country may not have, and if they do have, are funded in different ways. The Baker Foundation and other groups like them just make that easier for us and for the Cancer Center to get the equipment that they need in order to do a great job.
What people don't realize is we receive $0 for any type of equipment or capital needs from the government. So when we have programs like the cardiac program, even dialysis with the need for new equipment, with the Da Vinci robot machine, it's groups like the Baker Foundation that come forward and help support each of those things.
I think technology has really revolutionized the way we basically approach patients with any sort of disorders. Technology has given us a more accurate depiction of what is going on internally to better help not only treat them but manage their clinical problems. The Da Vinci platform has revolutionized how we treat patients with prostate cancer. We're very fortunate here in our St. Clair region to treat patients with this robotic platform. It's a new technology that's been around roughly for about 10 years, and it's provided patients with a minimally invasive approach to deal with prostate cancer. The addition of the robotics platform to the hospital, I think, has garnered a lot of attention to the Windsor Regional Campus. I think facilities outside of Windsor recognize now that Windsor is a place to reckon with. So I think it really has placed Windsor and Windsor Regional Hospital on the map academically and medically.
The Baker Foundation has done a significant investment in healthcare, and without them in Windsor-Essex, it would be dramatically different. As we move forward towards the new state-of-the-art acute care hospital and the investment in the Windsor-Essex hospital system, I know the Baker Foundation is going to play a significant role in that. From other perspectives, other industries, other not-for-profits, they have supported so many different ventures across our region for the benefit of our region's population. They've touched everything.
It takes a really special community to realize the need, and especially with healthcare. I think it's all of our jobs as a community as a whole to really help those who need it the most. And through the partnerships like the hospitals, the Baker Foundation with their donations to help us evolve, that's really how we exist, and that's really how we've had this 20-year legacy that we've had. I think it all ties together, this circle of care.
In the city of Windsor, we need as many resources and as many happy places with, highly trained individuals to help out kids. They are our future. We want them to be healthy. We want them to have a place where they can come and grow as individuals and lead productive lives and be leaders in our community and help out. We could not have been a part of this project and made our $1 million commitment if we didn't have the support of individuals, families, business sponsors, and others such as the Baker Foundation for doing such an amazing job in stepping up and saying, we want to help with this initiative. It's so comforting to know that we have other like-minded individuals who recognize the importance of kids in our community and their health and well-being.
With the opening of the new renal dialysis services at the Bell Building, the services are exceptional. Our patients love it. Our staff love it. It shows what can be done with investments in infrastructure that can help support a nicer place for patients to get the services. These patients are there 3-4 times a week getting dialysis services. Now they're in an environment that has natural light coming in, that has a lot of space. Without the Baker Foundation, none of that happens.
The donation provided to the hospital and to help our program develop our robotics system has been unfathomable. And this donation has certainly allowed us to provide a higher level of healthcare to our patients that some provinces still don't see. So we're very fortunate and very lucky to have such giving patrons within our community.
There are so many things that people can contribute to now in society. It's hard to get dollars. And the Baker Foundation has really, helped us to advance research funding at the University of Windsor. I really have to just thank them for their contributions and for really moving things ahead in terms of what we can do for patients of our community.
Our cancer community thanks everybody who makes donations, big or small. And of course, today is a special thanks to the Baker Foundation.
They're the silent supporters. You really don't hear a lot about them. If you were to ask someone on the street who the Baker Foundation is, a lot of people don't know that. But without them, we don't have what we have today. From cardiac cath, to renal, to cancer, to men's health, just to name a few, the Morris and Beverly Baker Foundation have made a significant impact on healthcare for Windsor-Essex.